Sometimes in my life, I try to reflect back. I try to remember, how was I when I was 12 years old? And suddenly I realized that I was a girl. I was a girl who had lots of questions. The questions which made people very uncomfortable. I realized that I had big dreams. The dreams which people think I should not even think of. I was born in Ranchi, in the state of Jharkhand. I grew up there. It is a state in North India. My mother, she used to teach in a medical college, and this medical college was conveniently located near my house. So I played in the corridors of that hospital. The hospital crowd, the white coats, the stethoscope, they fascinated me. And suddenly, there was a dream that was rooted in me. I wanted to become a doctor. So, there was only one choice, to compete in a public medical college, because private ones were not in our reach. I studied hard. I secured a seat in a medical college. And fortunately, this was the same medical college where my mother used to teach. I still remember when I came home for the first time wearing this apron. I still remember the pride and satisfaction in her eyes. And there was a dream that shaped. And that was the beginning where I am. But when I entered the medical college, the reality was very different. There were people from different classes. There were people who were privileged. The students who were very confident. They would answer any question. Their attire was confident. They would enter the class very confidently. And then there were students who were not very confident. Although they were very competent, sometimes even more than them. I tried to find out what was this. And then suddenly I realized there were people who were from the so-called upper class or the privileged group or the caste, as we say. And then there were students who were from certain tribes or the lower caste or the marginalized population. But then I realized that when you are a woman from these groups, there was a double burden. You are not supposed to speak. There was an utter silence. I tried to question because as a child, I always questioned. And then I suddenly realized that nobody was answering, or I should say nobody wanted to answer. Somebody thought I was too naive. Somebody got annoyed. And someone, if they wanted to answer, if they were very dismissive, they just said that men doesn't want women to the leadership positions. And I thought, this is India, when we have seen already a women prime minister. And in the ground of medicine, women leadership was still doubted, still challenged. But when it was happening inside the campus, the outside was same. I got married to the love of my life. He was from Nepal. I came to and decided to move to Nepal. I came to Nepal with a love in my heart and stethoscope in my suitcase. I joined BP Koirala Institute of Health Sciences as medical officer. And now my struggle started. From a young, confident, ever-talking girl, I became a very silent person. I was a stranger in all the rooms. It was very difficult for me to follow the everyday's conversation. I still remember people making fun of me. They will try to tell me, okay, tell this word. And actually, they were actually making fun of my accent, sometimes the tone, sometimes the choice of the words. It was difficult for me. And before I could understand, I was given another name. And that was Madhisis. I didn't know this word beforehand. I didn't know what it meant But then it was painful. It was painful sometimes. So I moved on. I was posted in gynecology department. I saw the women dying from ruptured uterus, obstructed labor, septic abortions. I saw the cases of gender-based violence. I saw the cases of sexual assault. That made me think that I should be taking gynecology. I did a post-graduation in gynecology just to help these women. But then the challenges were the same. I still remember the female doctors had to prove themselves day in and day out. They had to work double to get the recognition which a male doctor got. I still remember their ideas being stolen by the male counterparts. When I speak this, we all think that this is not which I did. It's not about I, me, you. It is about a pattern. I'm talking about a pattern. So it happened. And then I tried to look very closely to the leadership positions. And in the hospital, it was a men's club, all men. It was close, comfortable, and unquestioned club. It made me uncomfortable. So I just thought that if I need to do something in my life, I need to move out from this hospital. I moved out. I got a Fulbright scholarship. I got to States. At Johns Hopkins University, I studied health disparities, which is so close to my heart. And then I studied maternal and child policies. I learned all the skills which I needed. I returned back, and then I started working in one of the tertiary care hospital in eastern Nepal, Biratnagar. I joined Koshi Hospital. I worked very hard. I really worked very hard because I wanted to make systems in place. I wanted to help all these women so I could drive a 110-bedded hospital. I could place the reproductive health policies in place, help these women. But then, when I saw how was the administration going on, the administration was still a men's club. All men. And all the women doctors who were working day in and day out, they were judged on the basis of their color, their physique. That was intolerable. And the most intolerable thing for me was that nobody questioned. And I started questioning. And that was the time when I decided that it is the time that we need to be on the decision-making table. Because there was no women on decision-making table. All the decisions for women, for the women's health, for the working of the women, for the working hours, the duty rosters, all being made by men. So I decided that if I need to change something, I need to reclaim that table. And that was my turning point in my life. I started to move. I moved from delivery room to decision room. In March 2020, I was offered a position of medical superintendent of Koshi Hospital. I was the first medical superintendent of the hospital. And as a first medical superintendent, you can understand there were confusions about my leadership. Everybody was questioning. And while I was settling how to manage my leadership, how to lead the hospital, everything changed. The COVID hit. Now, the whole hospital was in a chaos. There was uncertainty, there was fear. But as you say, that the leadership is tested in the time of crisis. I was tested too. With some resistance, I could make a small team. I made the hospital running. We made the first isolation center in Nepal. We made the first COVID treatment facility in Nepal. And we made the hospital operational when everything was closed in eastern Nepal. And that changed the perception. And in those 3 months, I was turned from a dedicated gynecologist to a woman leader who could get things done on the ground. It was while this was happening, suddenly I was offered, later that year, I was offered a position to lead maternity hospital. I came to Kathmandu. Because I was a gynecologist, I had a degree in public health, maternal and child policy, and this was the best platform for me because thousands and thousands of women were taking care. I came to the hospital. I tried to make systems run. We made protocols. We did training. I tried to make system because COVID was still on. We made rapid response facility for pregnant women and we made delivery facilities. But still, the challenges were the same. Kathmandu did not welcome me. They were again skeptical, not of my competencies, but because of my identity, which Nepal gave me very affectionately, a Madhesi woman. How can she lead? Anyways, one of the projects which was very close to my heart was Human Milk Bank. I really wanted, there was no Human Milk Bank in Nepal, and that was my dream project. I thought that I should establish one. So I went to the Health Ministry, I presented and asked for the budget. People ridiculed, they laughed at me, and I was not allocated any budget. But then I persisted because I knew that this idea was going to work. I could talk to different agencies, and today, there is a milk bank. I could establish a milk bank. I named it Amrit Kosh, or the Nectar Bank, and it is still operational, getting expanded to the provinces. After some time, I thought that I should move to the policy. So I moved to Ministry of Health and Population to take the lead of Health Coordination Division. One of my TOR was working as a spokesperson of Ministry of Health and Person. I was the first female spokesperson. I tried hard because this was one area which was totally male dominated. It was very difficult for me to navigate those untraded spaces. My ideas were refused sometimes. I was ignored. I was really ignored. I could remember, or I still remember, the body language of my male counterparts when I floated some ideas. One of my work as a female spokesperson was to do a national briefing on COVID and health. And that was a live briefing. I still remember people publicly commenting, or sometimes on social media, sometimes about my accent, sometimes about my naturalized citizenship, sometimes about my hairs, and sometimes about my color of my lipstick, but it didn't shake me. I worked, and slowly everybody realized that I had something which they didn't have. I was promoted to Additional Health Secretary. As Additional Health Secretary, again, there were 4 additional secretary, and I was the single woman. So again, I was in the men's club. Most of my ideas were not accepted, or sometimes ridiculed. After some time, I was offered the position of Director General of Health Services. A woman who was just leading a hospital was given the responsibility of the health system of Nepal. I was leading all the public health programs. It was a very difficult time. I was trying to negotiate with the partners. I was trying to facilitate all the programs. But one thing was in my head, that all the programs needs to be focused on women, children, and from marginalized population. I made sure that women were at the center. I made sure that women who worked in the office, their voices were heard and they feel important. I was working as Director General, and then I was again asked to come to the ministry where I was working. In March 25 this year, few months back, I was due for a promotion to health secretary. By all means, technically, legally. But I was denied that position. Not because I was not competent. And that position was given to a man who was from upper class. I was denied not because I was not competent. It was because I did not align to the interest of the political leadership of the ministry, which was not quite unusual, but it was painful. It was very painful. I was devastated. I was very devastated. It shook me to the core. I was angry. And I again thought, why did I come here? Why did I come to this country? But then I thought, I represent thousands and thousands of women like me who are experiencing this type of discrimination day in and day out. So I decided to fight, and that fight is still going on. Because that fight is not only for me. If I don't fight today, then who will? And what kind of legacy I'm going to leave behind? So that struggle is still going on. So my story, it's a very simple story. It just shows that girls who are there, who are from marginalized group, they can also do extraordinary things. The only thing that you need to think, you need to dream of, it is all about fighting for equity. And equity must transcend borders because injustice doesn't have boundaries. They don't have boundaries. So to all the young women who are listening to me, believe in your dreams. Just go for it. To all the women who are struggling in their workspaces, just think that you are more powerful than you think. You are more powerful, your voice is important, so go and reclaim the space. If anything that I have learned from my life is that justice is never given down. You have to claim it. You have to claim it. So go for it, claim it, because if you rise, you don't rise alone. You rise with all of us. Thank you so much.